Today, we're going to pull back the curtain on one of the most critical processes in all of modern medicine, the surgical journey. We're going to follow a patient from the very first sign that something's wrong, all the way through their recovery, and uncover every crucial step along the way.
You know, when you think of surgery, your mind probably jumps straight to the operating room, right? But that's really just one chapter in a much, much bigger story. It's a whole journey that's planned out with incredible detail, involving diagnostics, preparation, the procedure itself, and a really carefully managed recovery.
So where does it all begin? Well, it starts with a problem, a question. This first stage is all about detective work, figuring out exactly what is going on inside the body. Welcome to the world of diagnostics. And diagnostics is really both an art and a science. It's the absolute critical first step, and its purpose is pretty straightforward. Get the diagnosis right. Every single decision that comes after, whether to operate, how to operate, and what to expect, it all hinges on this initial conclusion.
And this is where that detective work has just completely transformed. On one hand, you have the traditional methods, right? The physical exam, some basic tests. But on the other hand, these innovative methods, they're like giving our medical detectives superpowers. Seriously, advanced imaging and molecular analysis let them see problems inside the body with incredible accuracy, and they can often catch them way, way earlier than ever before. Okay, so once a diagnosis is made and surgery is the plan, the next battle begins. And this one is fought on a microscopic level against an enemy you can't even see: germs. Preventing infection is absolutely everything.
Infections that come from outside the body are called exogenous infections, and they have all these different highways to get in, through the air we breathe, from surfaces we touch, from person to person, and most critically for surgery, through an open wound. This is exactly why a surgical environment has to be an absolute fortress.
To win this war, surgeons use two key strategies: asepsis and antisepsis. Think of it this way. Asepsis is the shield. It's all about preventing microbes from ever getting near a sterile environment in the first place. Antisepsis, that's the sword. It's used to actively destroy any microbes that might already be on the patient's body or in the wound. And you absolutely need both to keep a patient safe. And that sword of antisepsis isn't just one weapon, it's a full-on arsenal. You've got the mechanical approach, literally washing away debris and damaged tissue. There's the physical, using things like UV light, the chemical, with powerful antiseptic solutions, and finally, the biological front, where agents like antibiotics are deployed to fight infection from the inside.
This all builds to one single powerful principle: the golden rule of asepsis. It's so simple. From the surgeon's gloves to the tools, if it's going to come into contact with the wound, it has to be sterile. This one rule is the absolute bedrock of modern surgical safety.
With the battlefield sterile, it's time to prepare the most important element of all, the patient. And this phase is about so much more than just physical prep. It's about making sure the person is ready in every single sense of the word. This checklist really covers the human side of surgery. It's about making sure the patient is mentally prepared and they understand what's coming. It involves protecting their private information, and, critically, it covers informed consent. That's the ethical cornerstone where the team explains everything, empowering the patient to be a partner in their own care. And of course, there's the plan to manage pain. Anesthesia is what makes all of this modern surgery even possible. Whether it's local anesthesia to just numb a small spot, or general anesthesia that puts the patient into a deep, controlled unconsciousness, its entire job is to ensure the procedure is painless and safe. And now we arrive at the main event, the operation itself. We're in the operating room, where a highly skilled team is working with incredible precision and focus. Let's take a look at what actually happens in here.
Now, the first thing to know is that not all surgeries are the same. They're classified in a few key ways. First, by timing. Is it an emergency to save a life, an urgent procedure that needs to happen soon, or an elective one that can be scheduled? Second, they're classified by purpose, which really defines the ultimate goal of the operation.
And this is a really important distinction. A radical operation is aiming for a complete cure. Think removing a cancerous tumor entirely. A palliative operation, on the other hand, has a different goal. When a cure is impossible, its purpose is to relieve pain and improve the patient's quality of life. Both are incredibly valuable types of surgery.
One of the biggest revolutions in the operating room has been the shift to minimally invasive techniques. Instead of one large opening, surgeons use tiny incisions and super advanced instruments. The benefits for patients are just transformative: less pain, much faster recovery, and minimal scarring.
And surgeons are pushing the boundaries even further with techniques like SILS, single incision surgery, and NOTES, where surgery is done through natural body openings. It's amazing stuff.
The final stitch is placed. The operation is over. But the journey isn't, not even close. The postoperative period is just as critical as the surgery itself. This is where the body begins the complex process of healing. Recovery happens in these distinct phases. You have the immediate period, those first few hours under close watch in the recovery room. Next is the early phase, focused on pain management over the next few days. Then comes the late phase, which covers that whole journey from hospital discharge back to normal life. And for some, there's another stage, long-term rehabilitation to fully regain strength and function. Now, healing isn't always a straight line. The body's just been through a major event, and despite every precaution, complications can still happen. This is exactly why postoperative care is so intensely focused on monitoring and jumping in at the first sign of trouble. The medical team is always on the lookout for potential issues. These can range from infections right at the wound site to more serious, system-wide problems like sepsis. Blood clots or thrombophlebitis are another concern, as is tissue death, which is known as gangrene, or even bones not healing properly after a fracture. Vigilant care is the key to catching and managing all of these challenges.
So we've gone on this entire journey, from a single symptom all the way through to recovery. But this journey is always changing. With innovations like robotic surgery making things more precise and AI diagnostics offering earlier insights, the entire field is moving forward at an incredible pace. It really leaves us with a fascinating question to think about. What will the operating room of tomorrow even look like?